So this is the MS Views and News 2025 MS Wellness Summit. Today's program is sponsored by Novartis and Sanofi, and I want to thank everybody for stopping and seeing our exhibitors here, and we give them a round of applause. Let's thank them all. Thank you. Dr. Ashwin Mehta is at the Memorial Neuroscience Institute of Broward County, and Dr. Mehta will be speaking with you about integrative medicine, holistic and complementary therapies, and you'll love listening to him. He has spoken for us many times, and I can't wait to have him speak again. So this is your mic. Take it away.
Thank you, Stu. Appreciate your kind invitation to be here with you all this afternoon. Thank you to everybody who was instrumental in organizing this wonderful, timely, and important event. So I am actually an internal medicine physician by training. My subspecialty area within medicine is sleep medicine. So we're going to talk a little bit about sleep, but I felt it was somewhat apropos that I was after lunch. So I have the enviable position of trying to keep you awake for my talk. After a lot of times people feel this little somnolence, little sleepiness after lunch. So we'll get up and do some movement, hopefully, in the course of my talk. But again, really delighted to be here with you all to talk a little bit about what integrative health is all about in the context of living beyond multiple sclerosis. And so I'm going to be talking a little bit about what is integrative medicine. A lot of people have these terms swimming around: complementary health, alternative medicine. What is integrative medicine and how is it different? I'm going to be describing the role of integrative medicine in the non-pharmacologic ways to improve quality of life in people who are living beyond multiple sclerosis. I'm going to be presenting some evidence as well for nutrition recommendations, physical activity, quality sleep, acupuncture, yoga, and of course we've heard already about mindfulness and really taking a very holistic view of what it means to improve brain health overall. So, we get a lot of questions about this term that's used very often. It's complementary and alternative medicine, what was formerly known as CAM. So it's interesting because many people, about 40%, use healthcare approaches developed outside of mainstream Western or conventional medicine for specific conditions or overall well-being. Well, historically speaking, when you would go to your neurologist after a diagnosis of MS, you would talk to them and ask them, well, what should I be eating or drinking? What should I be doing at home to improve my quality of life? Should I be taking this herb or that, drinking this tea, or using these supplements? And the historic recommendation was, don't do any of that. And the reason I'm glad that this is less and less common is because what historically was said, what historically was communicated by a medical professional to someone who is looking to them for therapeutic recommendations, what they're effectively saying is, nothing you do matters. I can treat you in spite of you. And that is an incredibly obsolete way of thinking, thankfully, because now we know that a partnership is incredibly important to improve quality of life and as well as treatment effectiveness when it comes to treating multiple sclerosis. So a little semantic lesson here: complementary versus alternative. Complementary medicine refers to using a non-mainstream approach together with conventional medicine. Alternative means using a non-mainstream approach in place of conventional medicine. So not only do we work with our Neuroscience Institute at Memorial, but about 50% of people who I see in my clinical practice have been diagnosed with cancer. And it's incredibly important that they understand this nuanced difference between complementary and alternative. So what we do in our integrative clinic is partner with our neurologists, is partner with our oncologists, is partner with all of the mainstream health professionals in order to use the non-pharmacologic, more lifestyle, behavioral methods of improving quality of life throughout the spectrum of care. So integrative medicine is a very patient-centered model. The first question that I ask patients when they come in to see me is, what are your goals? What would you like to achieve during your time with us? So it's a very patient-centric model, and it's very much a partnership. I tell my clients, If you come in, we have our multidisciplinary team. You bring yours, bring your family member, bring your friend. It's a partnership. It's a team effort. We span the spectrum from preventative approaches to treatment. And the reason for our preventive mindset is because a lot of the things that we recommend in integrative health, they take a little time to exert their positive benefits. What we eat today may not really impact our health so much tomorrow, but what we eat this month will certainly impact our health next month, the following month. So it's a lot of times we want to engage with our clients sooner rather than later when they've been diagnosed with MS. We use natural, effective, non-invasive interventions. We always really maintain an evidence-based and science-informed this is a central pillar of our integrative practice. So nothing that we do is without some scientific basis or strong rationale. And we use conventional as well as non-conventional modalities, as I will be describing. We engage mind, body, spirit. Some wonderful questions that were just asked after the Dr. Harris's talk, and questions about whether trauma, whether past experience can actually impact our not only how we feel, but actually give rise to very specific medical diagnoses. Well, what ancient healing traditions from all over the world have long recognized and understood is that what occurs in our bodies impacts our minds. Conversely, what happens in our psycho-emotional space also impacts our bodies. So this mind-body entity that is so incredibly important, we need to engage the power of our minds in the healing process, which is why I'm so happy that presenters like Dr. Harris have mentioned mindfulness in their talks. We encourage providers to model healthy lifestyles for our patients. So we try and walk the walk as best as possible. We focus attention on lifestyle choices for prevention and maintenance of health, and we always maintain that healing is always possible, even perhaps when cure may not be. So I'd like to introduce you to Huang Di. He was known as the Yellow Emperor of China, and he actually wrote a very impressive compendium of traditional Chinese medicine, which was the canon of Chinese medicine. It was written in 2600 BC. And Huang Di, the Yellow Emperor, was credited as creating the very first healthcare system. And in the very first healthcare system, you would pay your doctor a monthly stipend. As soon as you got sick, you would stop paying them. So the incentive was to keep you well. The incentive was prevention. The whole system was monetized to support good health, to support good well-being. Imagine that. So now here we are, 360 degrees later, right? And now we are seeing these models like value-based care models that are emerging in health insurance companies, and in Medicare and Medicaid. This value-based system, which focuses on patient experience, quality of life, population health. These things are incredibly important. So this is why integrative medicine has now established a very strong foothold in so many academic and non-academic health systems nationwide. It's very much a consumer-driven movement. We have entered an era of the informed healthcare consumer, right? You don't know something, you Google it. You don't know about this doctor, you look them up online. So the informed healthcare consumer is incredibly important when it comes to making informed choices and empowering ourselves with the latest knowledge in integrative medicine to improve quality of life in the context of multiple sclerosis. So here are some of the symptoms that we commonly see that are associated with MS. A lot of fatigue, changes in body composition, weight loss or weight gain, poor sleep quality, depression, anxiety, you've heard so much about these, chronic headaches, neuropathy, neuropathic pain, or spasticity-related pain, physical deconditioning, sexual dysfunction, constipation, or irregularities in bowel movements. All of these things are symptoms that we see very commonly. And I actually describe these as a constellation of symptoms. They're interconnected, they're woven together. And so oftentimes when you get into the habit of prescribing a medication or a pharmacologic agent in order to address some of these symptoms, you start to go down this rabbit hole where all of a sudden you're tacking on more and more medications, and then pretty soon you're taking medications in order to combat the side effect of other medications. So integrative health is a comprehensive approach in order to kind of break that cycle of over-medication by empowering people with what's the latest evidence regarding lifestyle and preventive medicine in order to help the brain heal. And I think that Dale Bredesen, who's a very impressive researcher out in California, has researched this very extensively. He wrote a book called The Recode Protocol. And he describes integrative health as it pertains to brain, as it pertains to our central nervous system. He describes these entities: inflammatory, atrophic or cold, toxic or sweet, vascular or pale, traumatic, dazed, sleepy or slow. Right? So it's a very nice book to read. And by the way, all his principles, Dr. Dale Bredesen's principles, are available online. We rely heavily on his work in order to help the brain just heal and improve the sense of physical as well as mental well-being in the context of living beyond MS. Here's a couple of things that we do in terms of testing. We always test hemoglobin A1C to evaluate whether there's a glycotoxic component to central nervous system health. Sleep screening. I mentioned that sleep is my darling because I'm a sleep subspecialist. Homocysteine levels, highly specific CRP and other inflammatory cytokines. Microbiome testing, heavy metal toxicity. ApoE4, these are lipoprotein profiles and genes that regulate our lipoprotein, our lipid metabolism. Vitamin D, we check for extensively. Thyroid functioning, hormonal testing, lipid panels, and most importantly, we do a body composition analysis to check for if there are any changes in muscle tone, lean body mass, body fat percentage, or basal metabolic rate, or our metabolism. So here's a cross-section of our integrative medicine plan or program at Memorial. We have a comprehensive nutrition team. We have a medical fitness program that uses movement as medicine. We don't call it exercise. We call it movement as medicine. Mind-body medicine techniques. We have mind-body medicine trained psychologists who are instrumental in this regard. I always do a sleep screen for everybody who walks through our door. We have therapeutic acupuncture, which is incredibly a vital component of our integrative program. We resource out, we refer out to massage therapists whom we work with in the community. We have a therapeutic yoga program, as well as individual and group programs. And really what we're trying to identify, the symptom cluster that we're really trying to unravel is this link between inflammation and pain. We say that wherever there's pain, there's inflammation, and wherever there's inflammation, there's likely pain. So we use this multimodal, multidisciplinary approach in order to address this link between pain and inflammation. So I was happy to see the salad and how colorful it was that we all enjoyed. So the more colorful, if you look down at your plate, the more colorful it is, the more likely that it's full of antioxidants and full of good fiber. So this is the difference between complex and simple carbohydrates. Simple carbohydrates, not a whole lot of fiber, not a whole lot of antioxidants. Complex carbohydrates have high fiber, high antioxidants. So in a nutshell, if you ever want to improve your overall nutritional horizon and practices, you just need to remember 10 words. Less meat, teat, wheat, and sweet. Less meat, less dairy, teat. Less wheat, processed grains, and less sweet, sugar. More roots, fruits, leaves, and flowers. Roots are carrots, beets, turnips, radish, ginger, turmeric. Fruits to your heart's content. Leaves are spinach, kale, green tea. Flowers are the cruciferous vegetables. You see here broccoli, cauliflower, asparagus, artichoke, cabbage. More roots, fruits, leaves, and flowers. Less meat, teat, wheat, and sweet. Done. Keep it simple. Right? And there is no nutritional perfection, right? We're not trying to ask our patients to live 180 degrees opposite to their current lifestyles. We are trying to engage them with motivational interviewing techniques to empower them with the latest science. I always print out the studies that I'm referencing. I say, look, we have a body of evidence that shows us that this is going to be good for you, and here's why. Linguists and neuropsychologists have done this type of research that the most convincing word in the English language is because. Our brains are wired to look for the rationale. Why? Why am I making these changes? Why is my plate so colorful? Where are my meat and potatoes? Right? So our brains are geared to look for the rationale, the why, the reasoning behind any change. And we draw extensively on Dr. Weil, my mentor in integrative medicine, he developed this anti-inflammatory food pyramid. And if most of what you're eating is on the bottom 2/3 of this pyramid, you're doing great. You see here, fruits and vegetables, nuts and seeds, beans and legumes, whole and cracked grains, right? Cold water fish for the omega-3 concentrations, right? So this is what we use as a foundation. And then we have a wonderful functional medicine trained nurse practitioner who does a nutrition comprehensive, and she does everything from a pantry and a pantry and refrigerator biopsy to training people how to read food labels, sharing different apps and online resources that can help us identify what ingredients are helpful and which are actually toxic, and additionally even share recipes that are palatable and easy to do. So really nice nutritional comprehensive evaluation. So just a couple things that we use from a nutritional standpoint. Cruciferous vegetables, I mentioned broccoli, asparagus, right? So what we find is that these cruciferous vegetables are high in these compounds called indole-3 carbanols, inositol hexaphosphate. These are really powerful antioxidants that are important for the central nervous system for brain functioning. Asian mushrooms. It's really impressive the type of research that is coming out on Asian mushrooms. And, you know, I was happy to see mushrooms in the salad today. Bottom line is, the more exotic they sound, the better they are for you, okay? Maitake, shiitake, inokidake, reishi, lion's mane, chagas, right? These are wonderful, wonderful mushrooms. The more mushrooms that you have, the better you probably are going to feel. Why? Because these mushrooms have very powerful immunomodulating compounds. Immunomodulating means that if your immune system needs to ramp up, needs to awaken, these compounds actually increase natural killer cell function. And conversely, if your immune system needs to cool down a bit, these medicinal mushrooms can actually do that as well. So we use them for many of the autoimmune conditions that we treat, including MS. Turmeric and ginger, the curcuminoids, very powerful anti-inflammatory and antioxidant effects. Green tea. A lot of times I find patients are kind of covering up their fatigue that they're experiencing with the cafecito, right? And I grew up here in South Florida, so I love my Cuban coffee, okay? And it's keeping a lot of sleep medicine doctors in business. But I got to tell you this. It is oftentimes important to value our sleep, and we're going to talk a little bit about sleep. And oftentimes, those individuals who have a habit, if you will, of coffee, especially that after the lunch, time when your energy level's kind of dropping during a busy week, and then you reach for that coffee. Oftentimes we switch them to an organic green tea. So you can have your morning coffee. If you're having a second and third cup of coffee, do the experiment. Switch that second and third cup out for a cup of organic green tea, because this has wonderful antioxidants, especially one of the most powerful antioxidants out there. It's this class of compounds called catechins, and catechins are very well represented in green tea. So organic green tea is your friend, especially if you're trying to wean down off of excessive coffee intake. Vitamin D. Vitamin D has plenty of immunomodulatory effects. To call vitamin D a vitamin is actually a misclassification. Vitamin D is actually more a hormone than it is a vitamin. But we checked, because even here in beautiful sunny South Florida, many of us are walking around vitamin D deficient. So ask your doctors to really check for your vitamin D level next time you have your visit. Turns out it's not just what we're eating, but when. We're talking about intermittent fasting or periodic calorie restriction. A wonderful study and we get these questions all the time. Doctor, should I be periodic fasting? Should I do some intermittent fasting? And the research shows that actually a period, 2 days out of the week, if 2 days out of the week, you have 75% of your overall calorie intake, just 75%. In other words, little bit of calorie restriction. That is actually really good, especially when it comes to T cell subsets and the metabolic markers that were studied in this group of people with multiple sclerosis. So very important. We check for basal metabolic rate. We check for body fat percentage. We check for lean body mass by using this method here. It's a bioelectrical impedance method. It's non-invasive, so you just stand on this fancy scale, and within a few minutes, the scale is telling you just how many calories you should be eating and drinking on a regular basis. Very, very important tool to regulate the changes that occur oftentimes with medication for MS. Yoga, therapeutic yoga is very, very good. This was a study in cancer patients that showed that this cancer-related fatigue or cancer-related cognitive impairment was improved drastically with therapeutic yoga. Wonderful research from the University of Rochester, and found that yoga improves overall cognition through sleep. So yoga improves sleep, which subsequently improves cognition, cognitive functioning, focus, memory, concentration, ability to focus on tasks that require sustained attention. Very nice study. There's also been randomized controlled trials on yoga and exercise in multiple sclerosis that have very, very promising results. So what we know is that anytime you exercise, you are actually decreasing the overall inflammatory burden in the body. You're decreasing these inflammatory cytokines like interleukin-6 and other inflammatory mediators. You're accomplishing beneficial changes in body composition, which over time decreases inflammation. And we know that with any autoimmune process, inflammation is a way in which any autoimmune disease actually creates the damage to main organ systems, including the central nervous system. So our goal is to improve energy levels, experience less fatigue, improve sleep quality, and reduce risk of intermittent exacerbations. So this was a really nice trial that looked at a multimodal, a multifaceted exercise training program in MS with 83 participants that included aerobic as well as resistance exercise in a supervised way. And they found that there was very impressive improvements after 6 months in the 6-minute walk performance as well as peak power output. So very nice. Now let's talk about sleep. So if you think about, our integrative approach to MS, you just need to remember 4 words: food, mood, move, and snooze. Those 4 words: food, nutrition; mood, our state of mind; snooze, sleep; and movement, our exercise, right? Our physical activity. So these 4 words are all you need to remember. So we are in an era of bright screened electronic devices. And what this study shows is that bright association or exposure to bright screen electronic devices actually impacts our circadian rhythm. It impacts our brain and body's ability to access those deeper and more restorative stages of sleep. So it's very, very important that we avoid bright screen electronic devices. I actually use a 3-2-1 philosophy prior to bedtime. 3 hours before bedtime, stop eating. 2 hours before, stop heavy hydration. A little cup of chamomile tea is fine, but large excessive quantities of water. And 1 hour before sleep, avoid exposure to bright screen electronic devices. All of these screens, our cell phone, our TVs, our laptops, our notebooks, all of these screens were scientifically designed to stimulate the arousal center of the brain and prevent our ability to transition into deeper and more restorative stages of sleep. Why? Because as long as our eyeballs are on the screen, as long as we're clicking and scrolling, somebody's making money somewhere off of advertising, right? They don't care about your health, right? Bottom line is, avoidance of bright screen electronic devices is incredibly important to improve not just your sleep quality, but also prevent changes in metabolism that may contribute to obesity. And although this study was done in women, I have seen this phenomenon in men as well. So not only do these bright screen electronic devices impact our sleep quality, but they also change our metabolism and can change our body composition over time. Massage, we use massage very often. It's important to have good, for any of the clinicians in the audience, it's important to identify good, experienced massage therapists, right? Whom you can work with, especially for MS. So this is a study that looked at positive benefits of massage therapy on quality of life as well as leg function. Now talking about sleep. So, oftentimes our misconceptions and anxieties about sleep are what fuel insomnia, paradoxically. So addressing some of these misconceptions about sleep is an incredibly important way of improving sleep quality. Sleep is a balance. Sleep is a natural and innate process that is inherent to our physiology. So does anybody know who this is here? Okay, this is the world's only famous Mehta. This is Zubin Mehta. Zubin Mehta is the conductor of the New York Philharmonic Orchestra, and my philosophy about sleep is that it is like a symphony orchestra. If every single organ system in the body is a different instrument section of a symphony orchestra, they all have to be coordinated in a manner that gets them from one movement of that symphony into the next. That's like transitioning from one stage of sleep into the next. There are 4 stages of sleep: stage 1, stage 2, stage 3, and REM sleep. During REM sleep, it's very, very important. There's a brain and body cooling. Our core body temperature drops by about 1.5 degrees during REM sleep. What do they tell you to do if you hurt your ankle or your shoulder? They tell you to ice it, right? Well, we have a systemic icing mechanism that occurs during REM sleep because of that total body cooling by 1.5 degrees. So if we do not achieve enough REM sleep, inflammation is increasing, right? The reason they tell you to ice it is so that you decrease the local inflammation and that reduces the pain. Same thing that occurs centrally, same thing that occurs throughout the entire body. If we don't spend enough time in the deepest and most restorative stage of sleep, known as REM sleep, inflammation is gradually increasing because our body doesn't have enough opportunity to rinse those inflammatory mediators away. So very, very important that we get good quality sleep. Why do we sleep? What's the importance of sleep? Well, reversing the damage from wakefulness, reversing oxidative stress. 30% of our total metabolism goes to one organ in the body, our brains. So imagine just how much oxidative stress there is. Repleting energy stores, very important. Stimulating brain development. Brain development occurs, again, during REM sleep. Regulating ion channels, learning and memory. Consolidation of short-term memory to long-term memory occurs also during REM sleep. Optimization of so many other physiologic functions. So this is a little more biochemistry than I wanted to get into, but really what I'd like to draw your attention to is this. Almost every medication that we use for depression will decrease REM sleep. So this is why it's important for our doctors and care teams to ask the additional questions. Is it a sleep concern or is it real depression? So that's why Dr. Harris's talk just now was so appropriate and timely. There are also metabolic changes that occur with poor sleep. Sleep loss adversely affects so many metabolic hormones, cortisol, sympathetic activation, thyrotropin levels, glucose tolerance, ghrelin and leptin, what we call the satiety signal, the communication between our gut and our brain that tells our brain, hey, we're full, stop eating. We don't need any more food. That satiety signal is regulated by these 2 adipokines, leptin and ghrelin. And if you're sleep deprived, the communication between the digestive tract and the brain, it stops. So that satiety signal is turned off. So I have so many clients who say, look, Doc, I have a perfectly healthy dinner at 7:30 at night. And by 9 o'clock, I'm rummaging around in my pantry and looking for a snack. What's going on? So this is the reason. It's because that satiety signal has been downregulated. So these endocrine changes can contribute to altered signaling of hunger and appetite, which may promote weight gain and obesity. So we always check. We always ask about sleep quality. Physiologic effects of sleep loss. Sleep loss also alters our immune function. This was a study that was done on individuals who were receiving the flu vaccine. So people who are sleep deprived actually have less uptake of the vaccine because their immune system is depleted, is degraded, is compromised. There's also decreased antibody titers and increased inflammatory mediators. So what is the most common sleep condition? The most common sleep condition is insufficient sleep syndrome because we don't really value sleep. We hear it all the time. Oh, I'll sleep when I'm dead. Well, actually, you're going to die a lot sooner if you don't sleep well. Okay. So it's really important that we place some value on sleep. Okay. Acupuncture. We have 2 phenomenal acupuncture practitioners in our integrative program, and we rely on them heavily because acupuncture is really tremendous in its therapeutic impact and can be very, very helpful, especially for spasticity-related pain and fatigue symptoms. Mindfulness. You've heard so much about mindfulness today, and it's really, really important to understand how it works. Why? Because the most convincing word in the English language is because, right? Well, mindfulness helps because it's been studied, right? We know that there may be some initial unpleasant increase in awareness of disability, generally followed by greater acceptance and self-compassion, right? Things you've heard today. And other benefits reported include improved relationships, improved compassion, improved walking and sleep with less stress and less pain. So all really wonderful benefits. So reduced psychological symptoms like depression and anxiety. So again, that mind-body medicine technique. Mindfulness actually changes the structure of the brain. And this was a wonderful study in 2011 published by Holzel and colleagues that looked at 8 weeks of sustained practice. You don't have to do 27 minutes of meditation every day. But the bottom line is that even 8 weeks of sustained practice increased gray matter of the brain, increased the gray matter density in several regions of the brain. So mindfulness changes brain structure and function. How does it work? Well, it changes certain short-term gene regulations, increasing energy metabolism, increasing mitochondrial function, increasing insulin secretion, telomere maintenance, decreasing inflammatory pathways, and decreasing stress-related pathways. So, in closing, integrative methods can be used to improve quality of life alongside standard of care treatments for multiple sclerosis. Remember these 4 words: food, move, snooze, and mood. Acupuncture, yoga, massage can be safely used as supportive measures during MS treatment, and certainly keep a lookout for more high-quality, evidence-based research that comes out looking at the need for non-pharmacologic and lifestyle modifications to help symptoms of MS and treatment. Thank you so much for your attention. I look forward to your questions.
You talked about poor sleep. How does that affect, though, the people who have problems like from arthritis or similar conditions?
Yeah, so any itis, whether it's arthritis or pneumonitis or cystitis, any gastritis, any itis by definition is an inflammatory process. So if we allow ourselves to spend enough time in those deeper and more restorative stages of sleep, inflammation is gradually reducing over time. So it stands to reason that improving sleep quality is a nice adjunct to standard of care treatments for arthritis as well.
All right. Next one is with regard to lack of sleep. Again, lack of sleep. What is it doing to people who need to lose weight?
So great question. And I kind of touched on this a little bit in my talk when I was talking about the adipokines, leptin and ghrelin, the communication between the digestive tract and the brain that tells our brain is full. So actually, sleep deprivation is a stressor for the body, right? So one of the most common reasons for chronic stress, evolutionarily speaking, more than 150 years ago, the most common reason for chronic stress was scarcity of food and scarcity of water, drought and famine. So when we are not sleeping well, when we have those chronically elevated stress hormones, our brain and bodies get tricked into thinking that we must be in drought and starvation mode. So that satiety, the reason the satiety signal is turned off is because our bodies anticipate having to walk further the next day for food and water. So this is one of the reasons why the leptin and ghrelin, those adipokines, that satiety signal is disrupted with chronic stress and can impact body composition as well as satiety in the context of MS.
Okay, next question.
Yes, my name is Alberta, and I would like to know what is the reason of getting up at night, going to the bathroom, coming back to bed, and can't get back to sleep?
So very good question, Alberta. So a couple things. One of the things, like I said, one of the most important aspects of improving our sleep quality is to address commonly held misconceptions that we all have about what good sleep looks like. We think, unfortunately, that we need 7.5 to 8 hours of uninterrupted blissful oblivion in order to be our best selves the next day. And that's actually not true. So what has emerged in sleep medicine is the latest research in sleep shows this biphasic sleep pattern, where actually you have a nighttime and a late night period of sleep punctuated by about 45 minutes to an hour of wakefulness. So the key is don't spend too much time in bed if you're not sleeping. Why does this occur? This occurs because evolutionarily, again, over millennia, over thousands of years of human evolution, it was the matriarchs and the patriarchs of the tribe who would wake up in the middle of the night, check on the tribe, make sure everybody was safe, go down to the creek and get water to make sure the tribe can continue function in the morning, check on the fire, maybe chop some firewood. There were chores to be done in the middle of the night, and they were done by the matriarchs and the patriarchs, the grandparents. So every year that we age, that alarm clock gets louder and louder, and this is part of our human evolution. So don't catastrophize the nighttime awakenings. If you come back to bed and it takes you more than 15 to 20 minutes to fall back asleep, get out of bed and do something else. I empty the dishwasher, fold some sheets and towels, right? Any chores that I have to do around the house, I do them at that time. You're welcome, honey. And then I go back to sleep when I'm tired, right? So this is a way that decatastrophizing the nighttime awakenings, and don't spend too much time in bed. Thank you for your question.
Next question's over here.
What is the worst case of insomnia you've seen, and how were you able to reverse that?
Oftentimes, people with really chronic insomnia, whether it's sleep onset or sleep maintenance insomnia, what ends up occurring is that they end up in this dreamlike state, even during wakefulness. And so often, and they're not really reliable in telling us how long they've slept or how often they actually get to sleep. So what we do is we do actigraphy. So a lot of these wearable technologies that we have now are wonderful tools, whether it's a Fitbit or Garmin or Apple or whatever tool you have, is a nice way of objectively identifying sleep patterns. So that's the first step, is objectively identifying sleep patterns. Second step is addressing sleep hygiene, avoidance of bright screen electronic devices, right? Circadian entrainment, morning activity. If you get a little bit of movement as medicine, not exercise, movement as medicine in the morning time with bright light exposure, that helps anchor our circadian rhythm. And then use the 3-2-1 philosophy in the evening time, maybe do a mind-body medicine technique that you enjoy. Breathing exercises, guided imagery, creative visualization, affirmations, a gratitude practice, writing in a journal, whatever it is that you like to calm the mind and help decatastrophize those nighttime awakenings. That's the key to treating insomnia.
Right. Thank you, Dr. Mehta. Great. Awesome.
Thank
Can you repeat the name of the book and Dr. Rico?
Yes. This is Dr. Bredesen, Dale Bredesen. Dr. Dale Bredesen wrote a book called The Recode Protocol. And it's a nice framework when it comes to most of his work is on cognition, is cognitive impairment and cognitive decline with age. But the way he frames it, inflammatory, glycotoxic, right, sleepy, slow. So the way he frames it is really nice, and it provides a really good framework for how we address brain health in an integrative way.
Thank you. Question, what do you say for people who have pain in their leg while sleeping on one side if they're a side sleeper?
Yeah, that's a great question. So what we say is, wherever there's pain, there's inflammation. Wherever there's inflammation, there's pain. So first step is to reduce the inflammatory burden in the body by using the things that we've talked about today, right? We looked at movement as medicine, therapeutic yoga, right? Mind-body medicine techniques, and also checking for nutritional components, right? Sometimes a little extra magnesium in the nutritional in the diet can actually help those spastic related inflammatory related discomfort that impacts sleep quality adversely.
Thank you.
Thank you, doctor. Taking medicine at night can affect sleep?
Some medications can affect sleep. So it's important to have a conversation with your doctor. Anytime we do not do a great job in modern medicine to talk about the negative effects of anything that we're prescribing. So it's up to us then to ask, Doc, could this potentially affect my sleep quality? most medications out there, even the ones for MS, can actually make us a little sleepier or adversely impact our sleep quality. So that's a great question. I would encourage, whenever you get prescribed a new medicine, talk to your doctor about sleep and how important, and just convey your preferences. Convey what's important to you. That's why the first question that we ask our patients when they come to see us is, what are your goals? What is important to you? What is your priority? And then we take those broader goals and we shrink those broader goals down into specific, measurable, achievable, relevant, and timely, the SMART goals. So I often say to my patients, I'm like a health coach with a medical degree. I will coach you as to what we can do non-pharmacologically to help improve your quality of life when it comes to living beyond MS and tolerating some of the untoward effects of treatment. Thank you.
Great, thank you. Our last question is right here.
So this is extremely informative. I just want to say thank you first before I ask my question. It's two-part. The first part is, in your opinion, how accurate or how much reliability can you find yourself in wearable technology, like something like a Whoop or an iPhone or an app like an Apple Watch to track sleep?
Yeah, I think it's a great question, especially because a lot of these devices are so commonly worn. I don't rely on these types of, wearable devices to actually make my medical sleep diagnosis. But anybody who comes in who's wearing any of these devices, I always give them a thumbs up and applaud them for at least tracking. Look, we cannot manage what we don't measure. So the first step is measuring our sleep, and I think being less concerned about how accurate they are, and kind of understanding that they're giving us a big picture overview of certain trends in how we sleep and how our energy level is impacted during the day. That awareness is a great first step. So we always encourage and applaud anybody who's using these wearable technology tools, and we kind of also share with them that we will not rely upon this data to make a medical diagnosis, but it's a great way of measuring something so that we can manage it. Thank you so much for your questions and attention.
And then with the abundance of nutritional supplements that are out there, I saw the one slide. I took a picture of it. I want to take it home to digest some more. But what is the most commonly prescribed supplement that you recommend for any patient with MS, without? What's your go-to?
It's a great question. So as it pertains to vitamins and supplements, we take a less is more approach in our integrative program. And the reason is because a lot of these medicines, whether it's plant-based medicine, a lot of the drugs that we use for MS, their metabolism can be impacted adversely by some of these other supplements, vitamins and such. So do we recommend vitamins and supplements when they're indicated? Yes, absolutely we do. But we refrain from adding to the pill burden that is already so significant oftentimes in people who come in for MS. I mean, not to tease you guys, but like the next slides that I had was the clinical guidelines from the American Academy of Neurology regarding cannabis. These are very common questions that we get, right? So, and that was why my presentation was 6 slides longer, is because I had a lot of those slides lined up in case anybody asked me about plant medicine or what are the most common plant-based supplements that we recommend. The key is use food as medicine first and foremost. If you have, it's very unlikely that a vitamin or supplement is going to really move the needle if we're not sleeping well, using movement as medicine, hydrating adequately, using mind-body medicine techniques. So those are the central pillars of an integrative approach. The vitamins and supplements are like icing on the cake. They can help, most certainly, but we use a very, very conservative and evidence-informed approach in order to guide vitamins and supplements. We have a pharmacist at Memorial who's our integrative pharmacist, and he's very good at drilling down into these herb-drug interactions. And so we're very mindful of that and guide our patients accordingly. Thank you for your attention.
Thank you. This last question, I hope that you will be able to answer. Where does Ayurveda fit in alternative treatment?
Yeah, it's a great question. So Ayurveda, traditional Chinese medicine, a major important concept in integrative medicine is drawing upon the wisdom of ancient healing traditions and using that in a very science-informed way to improve quality of life for people in the modern age. That's a very important component of integrative health. So we draw upon Ayurveda, yoga, Ayurveda, traditional Chinese medicine, the wisdom that comes from many indigenous cultures, even here in the Americas, right? So all these cultural and healing traditions, they had their own wisdom, and that wisdom is now percolating through the science and through the modern day research in order to really improve the quality of life for people who are living with chronic conditions like MS. Thanks again for your
Great.
invitation.
Let's give him a round of applause. Okay, so I'm glad that you all were here for that, and I think it was very beneficial. Thank you. Bye-bye.